Okay. Today we're going to be talking about vision and sports performance. I should tell you, my name is Dr. Valerie Fraser. I'm a developmental and neuro-optometrist. I practice in Waunakee, Wisconsin at New Horizons Vision Therapy Center. And I'm board certified in vision therapy, vision development, and overall, one of the areas that encompasses that is actually sports vision. So let's talk about why we're going to talk about sports vision. So when we talk about visual skills, it's important to keep in mind that we really do tend to take vision for granted. A lot of us equate good vision with some letters on the eye chart. This picture here is of Larry Fitzgerald. He's the Arizona Cardinals 2008 NFC West champions wide receiver and Pro Bowl MVP. He's widely regarded as one of the best wide receivers in the last, from a few years ago at least. He is actually our spokesperson for vision therapy. And the reason why is that he did vision therapy when he was a child, and he greatly helped him not only in sports, but he also attributes it to helping him with some learning problems he was having at the time as well. So here's a quote from him. "Parents don't realize that you need over 15 visual skills to succeed in reading, learning, sports, and in life. Seeing 20/20 is just one of those visual skills." So let's talk about, we're going to talk about what 20/20 is and why that's not a good measurement for how well you're going to be able to do at sports. And then we'll talk about what other visual skills would be important. So first let's talk about what 20/20 vision means. This is a standard eye chart that you may have seen before. And what you have here is a big letter E at the top. That's the 2200, letter E. Then as you go down the chart, the numbers on the bottom get smaller. So this is 2100, 2070, 2050. So this is just a measure of eyesight. So the top letter, 2200, is a big letter. Down here at the red line is the 20/20 line. That's what most people can see, this size letter at 20 feet away. So the first 20 has to do with how far away you are, and the second number has to do with the size of the letter. So it's just one measurement of good vision, and it certainly is an important measurement. But there's a lot of things wrong with it when we're talking about sports performance and how that it might affect sports. Because yes, it's true, if you cannot see the ball, you probably won't be able to hit it. But there are other skills that are necessary as well. So what are those skills? As Larry Fitzgerald indicated, there are 15 visual skills. However, we're just going to talk about the 9 most important skills for sports. Some of those other skills are definitely important for reading and probably even sports as well, but we're going to focus on these 9 just for time's sake. So tonight we're going to talk about dynamic visual acuity, eye tracking, depth perception, visual concentration, peripheral awareness, visual reaction time, eye-hand-body coordination, visual memory, and visualization. So let's talk about dynamic visual acuity. What is dynamic visual acuity? Well, it's the ability to maintain clear vision while something is moving. So that was my little demonstration there with it's called a Marsden ball, which is basically a ball hanging from a string. This is something you could make at home and hang from the ceiling. Sometimes we used balloons or softer balls for kids who are really afraid of the ball. You know, we're not just training pro athletes. Vision therapy is not just for pro athletes to improve their sports. We're looking at overall how to improve even for those kids that can't hit the ball or have a hard time with sports. So the other thing I'm demonstrating here besides dynamic visual acuity is that not only do they have to keep the ball clear, but they have to keep their eyes on the ball. So if we were going to hit this ball, you'd have to be able to track it and know where it's going. And of course, our eyes, when we're doing sports, have to make thousands of different eye tracking movements in order to stay with it. So those two visual skills are really important. One of the interesting things about dynamic visual acuity in baseball is that they use balls similar to this, or just even a regular baseball with large numbers or letters on it, and those that have trained this dynamic visual acuity will actually work on being able to see those numbers and letters as they're hitting them. So that's become kind of an important exercise for those, especially in baseball more recently. And those that can see the letters and read the letters as it's coming towards them often will be better hitters. So a different type of eye movement that we make has to do with depth perception. So what is depth perception? It's basically knowing how far away things are. So we get that from being able to use both eyes together. So we get information from the right eye and we get information from the left eye, and then the brain kind of puts the two images together, and from that it gets two different perspectives and gives us information about how far away things are. So that tells him how far away he'll need to throw that basket to get, or that ball to get into the basket, or when to hit the ball in the case of the batter here. If we go back to our example here, if the eyes are kind of focused or pointing beyond the target or what they want to look at, then the brain will say that this object is farther away than it really is. So they're going to overshoot the basket. Or if it's farther away, they might be a little bit late in their timing for baseball. On the other hand, if the eyes cross in front of the plane of where they're trying to look, right here, then the person's going to see things closer than they really are. So even if they're not getting double vision, they'll perceive things as being closer, and what will happen is that they might hit too soon as far as baseball goes, or they might undershoot the basket. So eye teaming is a very, very important part of being able to not only hit a ball, but even catch a ball. So to know how far away you need to be in order to, where you need to put that glove, how far out you need to put that glove in order to catch. Visual concentration and peripheral awareness are two sides of the same coin. What you really want here is a good balance. So when I talk about visual concentration, that's really important for this basketball player who the crowd is really trying to distract him from his eyes keeping on the basket here. So there, that particular athlete needs a lot of visual concentration to block out this distraction. On the other hand, this quarterback here needs to be really aware of his surroundings. And he needs that because he not only needs the visual, if he just focuses on one thing, like the person that he's going to throw to, then he might get hit by some other guy who's maybe, you know, over here on the side. So he has to be both aware of how far he needs to throw things, and he has to look at the person and be able to know who the person is, but he also has to be aware of his surroundings in that case. And that's true in basketball too. Let's say if you're going to pass the ball to somebody, you need to know that they're, you know, where your teammates are in order to be able to pass to them. Same thing goes in soccer. So most sports require a little bit of both visual concentration and peripheral awareness, and a good balance between the two. That leads us to talk about visual reaction time. So visual reaction time has a little bit to do with the depth perception, but it also has to do with I see it and I'm going to make a move. So how long does it take the brain to tell the hands and arms what to do or where to go? So that's really important for all kinds of sports, especially anything that, with a ball as well. One of the things with slow reaction times is actually tends to be an issue with going back to the eye teaming skills can cause a delay in reaction times. One of the programs that we have here that we'll talk about later has a program specifically designed to work on this reaction time issue where they see something move, see something move, see something move. And they also have to be accurate and move to the right place. We don't often think about it this way, but vision is really our invisible GPS. It guides the motor system and tells it where to go. So if the visual system is not working the way that it should, then it's going to be hard for the motor system to go where it needs to go. Or they'll have to rely on other cues that maybe aren't as efficient as their vision to get the same results. Same thing goes for here, eye, hand, foot, body coordination. So that goes right along with that reaction time, knowing, where the ball is, being able to move quickly and move to do what it needs to do to get that goal. And then visual memory and visualization. These two are very much related as well. So visual memory, what's that? That's being able to remember what you saw. So maybe out of the corner of the eye, the quarterback uses his peripheral awareness to spot a guy. He looks one direction, he looks back, and he remembers where that player is going to be. At the same time, he's also visualizing where that player might be moving to. As is Larry Fitzgerald right here as he goes to get this ball. He's visualizing the arc that the ball is going to take and where he needs to be in order to catch that ball. Visualization can be very powerful when it comes to sports. So, for instance, there was a study done that looked at tennis players, and they had some people or sub-subjects would actually practice their serve, we'll say. So they threw the ball up, practice, actually hitting the ball. Another set of subjects visualized or pictured themselves doing that same activity, pictured themselves throwing it up, hitting it, throwing it up, hitting it. And surprisingly, those that visualized the movements did statistically did as well as those that went out and actually practiced the movements. So visualization can be very powerful in sports. Not saying that it takes the place of practice, but it definitely can help. One thing that it's important to do, let's say in golf, is to get the right, if you overthink things, whether it's golf or tennis or anything else, if you start overthinking things and breaking down the mechanics, a lot of times you'll actually do worse. That's because visualization is a more global process. So you should really be aware of the kind of the big picture and the action as a whole rather than trying to break down every little part. But if you can visualize yourself doing something and then do it, you'll oftentimes be better at it than if you just go out and try to do it without the visualization piece. And that's my main point. And you can talk to kids about that. So before they go to hit that ball, you might talk to them about picturing in their head the ball coming towards them and the bat hitting it at just the right time. Or picture or visualize how far away the basket is and how far away they need to go to actually get it into the basket. You can do this with other sports that don't involve a ball. For instance, gymnastics. You can visualize a move before you do it. That can be very helpful in training. That's probably the best example that comes to mind for non-ball sports. But anything that, the other thing about visualization is that it can be powerful for just your overall, I don't want to say self-esteem, but your confidence level with what you're doing. So I guess it would even apply to track visualizing yourself going over the hurdles, or even visualizing yourself winning. So we talked about the tennis player, and that's certainly true of golf too. So let's talk about sports vision training. So when I started vision therapy, this instrument over here was what we had available as part of the vision and sports training. It was called the Wayne Saccadic Fixator, and that's what we used a lot. Nowadays, you can, for just $24,000, you can buy the Nike Sensory Training Station that does a whole bunch of different visual skills type programs in there that kind of train some of the visual skills we were talking about earlier. In our office, we have the not so expensive version, but has a lot of the same programs that the Nike program would work on, and that's called the SANET Vision Integrator. So with the SANET Vision Integrator, or we just call it SVI in our office, it trains, here's a handful of the things that it trains: eye-hand coordination, visual reaction time, hand speed and accuracy, peripheral awareness, visual concentration, saccades and pursuits. Those are the eye tracking movements that we make. Saccades are the ones when we move our eyes quickly from one place to another. Pursuits are when we follow a moving object. This patient here is using the pursuit function. It's obviously a still picture, but that rotator would be moving, and you would have to, it's a touch screen, so he touches the dot, it disappears, and he's well to try to be as fast as you can. Visual acuity enhancement, that has to do with that dynamic visual acuity. Anti-suppression, let's say one eye doesn't work as well as the other, the brain kind of shuts it off. We can work on that with this piece of equipment. Contrast sensitivity, that's being able to, in a darker environment, be able to tell when something's moving. That's really important for those athletes that practice at night. Vision directing action, of course, is important. There's some visual cognitive pieces that can be helpful with visual memory, and then also some divided attention that trains that visual concentration without losing peripheral awareness. Because really, when a lot of sports is again, having a good balance between the visual concentration but not losing what's going on around you at the same time. Vision therapy is definitely can help with depth perception. So this little girl here, we use a lot of 3D pictures in vision therapy to kind of tell how far away things are in space. These athletes are doing some reading, using some lenses, flipping them back and forth. This isn't in my office, but it was a good picture. And basically training that focusing system to rapidly react, so when they look far to near, that everything's in focus quickly for them. Now, one thing, and it's gotten a lot of press lately about how concussions can affect the brain and make it harder for those athletes to return to even activities of daily living, such as reading. Because vision dominates the brain, it's very likely after a concussion that vision will be affected in some way, either some blurred vision or double vision, difficulty tracking, very common. Even if the injury is, let's say, in the front of the skull, what happens is there can be a sloshing of the brain. So this is called a coup, which is the initial hit might affect the front of the brain, and then the brain sloshes back, and this part of the brain will get hit. So you can call the contra coup. So you can definitely get some bruising on both sides of the brain after a concussion. Hopefully it doesn't result in any bleeding, as this one shows. But what happens is, because of the force of the brain going back and forth, is you'll get some what we call brain shearing or swelling in this area here, which is kind of like at the base of where the the base of the neck where the skull meets the neck. And right there is the center of where all the eye movements that we make, including those eye teaming movements and tracking movements, and how the movements that our eyes make when we focus from near to far, are all located right here in that that base of the neck. So what happens after a concussion, even if there's only mild bruising here, is a lot of times even a whiplash accident that didn't involve an actual physical blow to the head will cause some shearing and some swelling here. And that can create some visual disturbances. So none of these, I mean, the bleeding will show up on an MRI or CT scan. However, the swelling and the tearing of these fibers of the brain right here often do not show up on a CT scan. But there's a lot of education going on in the medical community to recognize and quickly diagnose concussions, because it's really important that they're treated in a timely manner. Some of the visual symptoms that can happen after a concussion, we kind of pull these into a syndrome called the post-trauma vision syndrome. It's basically a subset of the post-concussive syndrome that you might have heard some things about. But some of the things to watch out for are double vision due to convergence problems. So that means that they might have trouble converging their eyes with each other or getting the two eyes to work together. Blurred vision, even with glasses, at near, or sometimes when it's bad, it'll happen at far as well. Poor fixations and pursuits. So that's pursuits, again, is that tracking of a moving object. Poor fixations is not being able to keep their eyes fixed on a target. They may also have a low blink rate and eye strain that may cause some dry eye troubles, especially at a computer. They may be very light sensitive and need sunglasses when they go outside. They can have headaches, especially with computer or near work. Motion sickness, especially brought on by having things move around them, can be a problem. Difficulties with escalators, so that's, again, that brings in that movement. Crowds, department stores. I have patients, some post-concussion patients that cannot go into stores or the grocery stores because they feel visually overwhelmed. Difficulty or discomfort working under fluorescent lights. What happens sometimes is these patients become very sensitive to movement, and unfortunately the fluorescent lights actually have a very high flicker rate that we don't see, and maybe even the patient doesn't see, but that the brain is picking up and is causing some disruption. The good news is that vision therapy is also effective treatment for many of these visual symptoms related to post-concussion. And I didn't even get into some of the memory and cognitive things that go on as well. But vision therapy is an important part of the rehabilitation process. If patients are suspected of having a concussion, they should see their doctor right away for a diagnosis. Or medical treatment for a diagnosis. And then rest is really important. But if things don't get better after a month or so, it's really important that the vision therapist be brought in to help move along the rehabilitation process. And for our students, unfortunately, a lot of these symptoms affect how they're performing up close, and so they don't have time to wait till things get better, because they need to get back to their schoolwork in order to keep up with everything that's going on. If you would like to know more about the vision and concussions, I did do a webinar, and that is located on our website if you wanted to check that out. So this presentation is now concluded. If you have any questions, feel free to email me at our info@NewHorizonsVision or NewHorizonsVisionTherapy.com, or you can give us a call. You can also check us out on Facebook. I often will post things on Facebook that I don't necessarily post on our website about little tips and things sports related. Some are concussion related. Sometimes it's just vision and learning related. So thank you again, and have a good evening.